Today, I want to talk about something every nurse will assess during every shift: pain. One of the biggest mistakes new nursing students make is believing that pain management begins and ends with asking, "What's your pain on a scale of 0 to 10? While the pain score is important, it is only one piece of a much larger assessment. As nurses, we need to develop a nursing mindset, one that helps us think beyond the number and truly understand the patient's experience. So let's walk through the pain management process together. So we're going to start with assessing. So everything begins with a thorough assessment. Remember, pain is whatever the patient says it is. Pain is subjective, meaning there is no laboratory test, x-ray, or vital sign that can accurately measure another person's pain. So our responsibility is to listen, to believe the patient, and perform a comprehensive assessment. One of the best assessment tools we have is PQRSTU. So we're going to ask what provokes or relieves the pain, have the patient describe the quality of the pain, determine the region and whether it radiates, ask about the severity, but don't stop there. Find out about timing. When did it start? Is it constant? Is it intermittent? And finally, understand what the pain means to the patient and how it affects their daily life. A complete pain assessment also includes choosing the appropriate pain scale. An alert adult may use the numeric rating scale, while children, infants, or patients with cognitive impairment require different assessment tools, such as the FACES scale, FLAC, or PAINAD. Remember, the pain score is simply one assessment finding. It should never be the only information guiding your nursing decisions. So now we're going to analyze. Once you've gathered your assessment data, it's time to analyze what you're seeing. So ask yourself, what type of pain is this? Is it acute or chronic, nociceptive or neuropathic? Is there an underlying condition that explains the pain, or are additional assessments needed? Next, think about the factors that influence pain. Pain is affected by age, fatigue, previous experiences, neurological function, culture, family support, spiritual beliefs, anxiety, depression, and even genetics. This is why two patients with the exact same injury may report completely different pain experiences. It's also important to recognize cues of pain. Some patients cry, grimace, guard the affected area, or become restless. Others may become withdrawn, silent, or irritable. Some patients may show very little outward expression, yet still report severe pain. As nurses, we must avoid making assumptions based on appearance or behavior. Pain is not something we judge. It is something we assess. Remember, no judgy. After analyzing the information, it's now time to intervene. One of the most important things to remember is that pain management is rarely just medication. Many effective interventions are non-pharmacologic and are based on the gate control theory of pain. By providing competing sensory input, we can help reduce the patient's perception of pain. Examples include applying heat or cold, repositioning, massage, relaxation techniques, guided breathing, distraction, music, and vibration devices like the Buzzy Bee that could be used during injections. These interventions often work even better when combined with medications. When medications are needed, always think about safety. Choose the correct medication based on the patient's assessment and the provider's order. Administer the correct dose by the right route and monitor carefully for effectiveness and side effects. For example, if you're administering an opioid, don't focus only on the pain score. Assess the patient's respiratory rate, their level of consciousness, oxygen saturation if indicated, and overall response to the medication. Remember that effective pain management always balances comfort with patient safety. The nursing process doesn't end once the medication has been given or the ice pack has been applied. Now it's time to evaluate. So ask yourself, did the intervention actually work? Has the patient's pain improved to an acceptable level? Can they now take a deep breath after surgery? Can they participate in physical therapy, sleep, walk to the bathroom, perform self-care? Those functional improvements are often just as important as a lower pain score. Also reassess for any side effects from the intervention. For medications, monitor for things like nausea, constipation, dizziness, sedation, or respiratory depression. If non-pharmacologic interventions weren't effective, consider what other options might help. Pain management is a continuous cycle of assessment, intervention, and reassessment. Remember the goal. One concept I really want you to remember is this. The goal of pain management is not always zero pain, especially for patients with chronic pain, cancer pain, or those receiving palliative or hospice care. Completely eliminating pain may not be possible. Instead, our goal is to help patients reach a manageable level of comfort that allows them to participate in the activities that matter most to them while minimizing medication side effects. That might mean being comfortable enough to sleep through the night, walk with physical therapy, visit with family, or simply enjoy a meal. As you move through nursing school and into clinical practice, challenge yourself to think beyond the number on the pain scale. Ask questions. Listen to your patient. Consider all the factors influencing their pain. Choose interventions thoughtfully, and always reassess to determine whether your plan was effective. Remember, great nurses don't just treat pain, they understand the person experiencing it. Think beyond the pain score. Assess, analyze, intervene, evaluate, because your nursing mindset makes the difference.